हमारे से हैंडल भी नहीं करा जा रहा, क्योंकि इतने इतने सब आ रहे हैं। ये तो बहुत ही बुरी स्थिति है, और ये कैसा हो रहा है ये तो रवि जाने। ये सर ले आइए, अरे ये जो लकड़ियाँ लाओ सारी इधर कीजिए, पैर उधर कीजिए सर। अभी तक जो है आज की डेट में अभी तक 90 टोकन्स बढ़ चुके हैं शवों के। अभी तक संस्कार में अकेले जो करवा चुका हूँ, 30 संस्कार में करा चुका हूँ।
India's outbreak is setting global records. Every day, another 400,000 people test positive, and more than 3,000 die. The crematoriums are so overrun because the healthcare system has collapsed. There's a shortage of beds, oxygen, and medical supplies.
अंदर में कोई जाएगा, जगह बनेगी तभी देंगे ना अंदर।
कहाँ पे लोग
मना नहीं करना।
So the thing is, patients are here for, they've been with us for a while. We can't really send them to other hospitals because there are no other hospitals taking them in. I really don't know what to say, because we have to manage the emergency care, we have to manage the patients like ward and ICU. Everything is being done in the emergency department.
Resources are so stretched that some hospitals are asking patients to bring their own supplies to cope with the shortages. Kuldeep Singh bought an oxygen cylinder and medicine, but he can't find a doctor to treat his brother-in-law, whose oxygen levels are plummeting.
डॉक्टर कम से कम और रेमडेसिविर लगा तो दे, मेरे पास पड़ी है, मेरे पास ड्रग्स पड़ी है, वो भी नहीं लगा रहे। मैं कहीं से ब्लैक में लेके आया हूँ तो भी नहीं लगा रहे हैं। यहाँ पे दवाई भी है तो भी नहीं लगा रहे।
As the family pleads for doctors, the police arrive.
हम लोग अंदर गए, अंदर भी कोई सुनवाई नहीं, कोई अंदर घुसने ही नहीं देता। हम पुलिस थोड़ा करा सकती हो तो डॉक्टर करेंगे। हम क्या हमारे इलाज चाहिए। मेरे पास इंजेक्शन भी है भैया, अब क्या करें, हमारे पास और कोई चारा तो है नहीं। मेरे को बताओ, पेशेंट तुम्हारे सामने है, पुलिस तुम्हारे सामने है, डॉक्टर तुम्हारे सामने है। हाउ टू, हाँ किसके पास जाएं? पूरा सिस्टम कोलैप्स है।
The health system here is so overloaded that it's now luck, more than medicine, that's deciding who lives and who dies.
The guy whom 41 year my big brother, we could have saved him. अगर हमें पहले पता चलता सर। 4-5 हॉस्पिटल में हम इमरजेंसी में गए, nobody is admitting him. 2 दिन से उनको लेके जिंदा रख के अपने गाड़ी में ऑक्सीजन लगा के घूम रहे थे। 4 घंटा नहीं रख पाए ये हॉस्पिटल। कंटेक्ट तो करना चाहिए ना बंदे को। At the moment we need support, medical support, oxygen support. हम उन बंदों को भी लॉस कर रहे हैं जिनको हम सर्वाइव कर सकते थे।
Welcome, everybody, and thank you so much for joining today. We have been doing webinars for many years now at Dasra, and unfortunately, this is the first one where perhaps everyone within India and globally know much more about the topic than ever before. In the next hour, we will have another 120 people die in India from COVID, and these are just the recorded deaths. Experts say it could be 5, 10, 15, 20 times that number. And in the last few weeks, we've had more COVID cases identified, again, reported cases identified, than the entire world combined. As Dasra, we've been in India now for 22 years. We've been working with organizations, local organizations, nonprofits on the ground during this time, providing support in various areas from education, health, livelihoods. These groups are embedded in the community. These groups are from the community. And these groups, as with all disasters, are the first responders. When this tragedy struck in the second wave, we very quickly started going out to our NGO partners to see if there are ways we could support. We, as an organization, have provided assistance in multiple disasters in the past, from the Gujarat earthquake in 2001, to the tsunami in 2004, to the Pakistan earthquake in 2005, as well as floods that have occurred in the country. We've always seen when disasters hit, one of the main things that need to be done is actually trust the communities on the ground who've been there for years, if not decades, because they understand the needs of the local community, they know what's happening, and they are best placed to be nimble and create solutions that are needed from their communities versus what is being dictated from Mumbai, Delhi, New York, London, or even Seattle. And that's why this time we realized, let us start a campaign. Let us figure out how we can support all of these local organizations that we've been so privileged to serve in the last 2 decades. And how do we trust their networks, their understanding of the community, and more importantly, their geography, because as we've all seen globally, what's happening in a different city, whether it's Mumbai, Delhi, Bangalore, Ahmedabad, or even different parts of rural India, is very different today on May 13th versus what it may happen on June 13th or even July 13th. And so this particular disaster that we're seeing ourselves in front of begs really the question of, does international NGOs in aid and the traditional ways of them dispersing this aid, which is a centralized solution going out, again, many times designed outside of the country, and a one-size-fits-all model, does that work? Or can we actually trust these communities on the ground to give them support, both funding, networks, being a sounding board, and allow them to make decisions? And so this experiments of sorts, which all of you have been so graceful in participating in, has allowed us in just 3 weeks to raise over $6 million. And I say this because this is the first time Dasra has ever done an email campaign. And that was less than 2.5 weeks ago. And these $6 million now are going to 60 locally based organizations across the country, giving these organizations the flexibility to do what is needed and whatever it takes at a time of need. There have been multiple webinars that other people have hosted over the last few weeks. Some of them have been experts, some of them have had government officials, many of them have also had philanthropists. And while all 3 of these stakeholder groups have played a critical role, Dasra's whole belief in even beginning our organization was to serve those that are serving others. And so today's webinar is actually 3 leaders of organizations who've been working in these communities, like I said, for years, if not decades. And this is just yet another disaster that they're providing support to. And we thought it was really important to hear their voices today. And so with that, I would love to open it up to our speakers. We have 3 established leaders of organizations that are going to be speaking today. We have Piyush from Save Life, we have Bijal Ben from MHT, and we have Purnima from Swasti. Each of these speakers are representing organizations that have different interventions that are operating in different regions across the country. And they've had both personal tragedies that they've seen in their families and with their colleagues, with their communities. And they've been working tirelessly over the last few weeks to really make a difference. And so with that, Piyush, I'm going to start with you. And I recall, in fact, I was just looking at the WhatsApp message I sent you 3 weeks ago, which was Monday, April 26th. And the question was, can Dasra do anything to help? We're seeing everything in the news regarding oxygen in Delhi. You're in Delhi. If you can maybe give our listeners a sense of what you have seen in the last few weeks when it comes particularly to oxygen, because you've played a critical role, not just for your organization Save Life, but I think also at a government level to help solve this crisis.
Sure. Thank you, Deval and Team Dasra for this opportunity to speak in this webinar today. Save Life Foundation's original mission, what we really do is to improve access to emergency medical care and to reduce fatalities due to road crashes. And that's something that we've been doing for about 13 years. And as a result of that work, we had an ongoing partnership with the government of Delhi, basis which we were working on this specific issue of emergency medical response. So when COVID struck last year, we saw that ambulance response times went into a tizzy. There was a significant lag between you calling for help and the ambulance arriving. And this was primarily because this was a new phenomena. People were panicking. There were large number of calls going to the ambulance service. And at that point, the government asked us to take over and provide support in improving the overall service. And we were able to very quickly start overseeing the service. We were able to create a system for aggregation of private ambulances into the service. And we were able to use data science to be able to improve their placement so that they can reach the people who are calling in the fastest possible way. And what we were essentially able to do was to increase the number of ambulances from 154 to 620. We were able to improve deployment patterns, and that led to the response time coming down from as high as 12 hours in some cases to under 20 minutes once our program was fully functional. Now, when the second wave hit, we were all struck. I had team members who were down. I had their family members who were suffering. I had family members who were suffering, and it was just an exceptionally tough time in terms of trying to understand what was going on in my personal network, and plus what the organization could do to respond. And at that stage, we decided that it was very, very critical to use the opportunity of being embedded into the Delhi government and bring on board some of our capabilities on procurement, on, we have people with military background, with disaster relief background, with emergency response background. So we very quickly put together a team to be able to do two things. One was the aspect of immediate help. What is it that we can do immediately? What can we procure instantly? So we started having calls and discussions globally. They ranged from talking about concentrators to cylinders to cryogenic tankers from Southeast Asia, and so on and so forth. And we were eventually, through support of some of our donors, including Dasra, we were able to very quickly procure some of those items. The second aspect was around the framework, around what is really going on and how can we support this at a larger framework level. And there we started looking at deployment of this material that was going to start coming into Delhi. And how do we ensure that there is no pilferage? How do we ensure that there's no black marketing of material that is coming in once pilferage happens? And at that point, Save Life team, along with the Delhi government team and a team from Boston Consulting Group, set up a system to be able to track every single unit of every single aid that was coming into Delhi, QR code it, and ensure that it goes to a designated health facility and that we're able to track it end to end. That was one. And the second thing really was that how do we make Delhi self-sufficient in terms of oxygen and in terms of critical care. Now, the thing about Delhi is that we're not just treating patients from Delhi alone. Delhi hospitals are treating patients from 8 other states. If you were to go in front of any hospital right now, you'll see ambulances from Uttarakhand, Himachal, JNK, Rajasthan, Haryana, MP, UP in line there. And that's what we saw during this late April to early May period, and which is essentially what overwhelmed Delhi and its supplies. So towards that, we've been working with our partners to establish oxygen plants to ensure that we have enough infrastructure to carry oxygen, whether it is thousands of cylinders, whether it is cryogenic tankers, whether it is production material, all of that is in place. And with that, we've been able to support some of the work that is happening. It's not just us alone. I must acknowledge the work of many, many other organizations, many, many other donors who have come forward to assist in this time and come forward with alacrity. It's not, we've had cases where people who would otherwise have a 2-week diligence process give money in 2 days. trusting us and trusting the fact that this was urgently needed to be able to save lives. So I'll stop at that, and they will hand over to you. If there are any questions, I'm happy to answer.
No, thank you, Piyush. And I remember in our conversation 3 weeks ago, I guess, and like I said, we sent an email out on Tuesday. On Friday, I spoke to you, and by that time, you had already dipped into your reserves by about 5 crores or about $700,000 to buy oxygen cylinders. And I think this is really important, just because when I spoke to you and your team on Sunday and Monday, there were a lot of conversations we had on concentrators. And the only reason this is really critical, and we've seen this again in Dasra with multiple disasters, is literally the situation changes every minute, if not every hour. And I think that's where not only being nimble to fund organizations, like you said, quickly, but also giving the NGOs the flexibility to use those funds as they see fit in this time of emergency is so important. And we've seen donors get it wrong so many times, where by the time something actually comes to the organization, or even the proposal was written, those line items or needs or goods even are no longer required. Yet again, the traditional way of funding is, but why didn't you follow a line item versus why didn't you meet the needs of the community as it stands on May 13th? Bijilben, I'd love to bring you in now. Again, the coverage across the world has been a lot about Delhi and what's happened there, but we've all seen and know that the effects of COVID has actually been worse in rural India. And I think this week, at least for the first time in many years, I would say, the press is actually writing honestly about what's happening in rural India. Given your outreach in multiple states and cities and towns across the country, I believe MHT works in 8 states and 34 cities and towns. Give us a sense of what's happening on the ground and what is MHT doing. You're on mute, Bijilben, sorry.
I'm so sorry.
Oh, again, you're on mute. Perfect.
Yes, thanks, Devalbhai. And this webinar really comes at an opportune time. I must thank you for organizing this, where we have a platform to speak. And as you know, we have been working with poor women in the informal sector across India. And these are the people who are the worst, because in the rural, you don't have access to medical facilities at all. The rural supply chains have actually broken, so the economy has broken. Livelihoods have, really got destroyed. Their small businesses have been completely destroyed, and some of them are going deeper and deeper into debts. Hunger is all around widespread because there is no money that people are earning. In the urban areas, in some sense, the challenges are that these are extremely dense areas, and so you can't talk of social distancing in slums. You have a 18 square meter house where around 7 people are living, so there are no isolation facilities, and you don't have access to sanitation or water. So you can't talk of say hand washing or your personal hygiene related to COVID. So I think extremely challenging. And we have actually focused on immediate relief and the medium-term response that we are giving now, essentially on 4 things. The first thing was to address food security. And here we really have partnered with the private sector, with Zomato and Swiggy, because the challenge was earlier in the COVID phase 1, we had a 3-month lockdown. And now we are almost a 1 month down into. Some states are having curfew and some states are locked down. So mobility is so restricted. So we are partnering with Swiggy, Zomato and the likes, and they are reaching meals and food ration kits to our slum centers and town centers. And these are being distributed by our community action groups. Almost we have reached 138 million meals till now across these states, with support from Dasra and other donors also. The second thing that we are concentrating on is bringing about a lot of awareness on COVID, because it was an extremely new thing that people were unaware of. Absolutely, the poor, we were concentrating on reaching health facilities, oximeters, thermometers, immunity boosters, etc., to pregnant and lactating women, people having non-communicable diseases like diabetes and blood pressure. I think vaccine drives are extremely important because there are a lot of myths floating around regarding vaccination. One very popular myth is that vaccine makes people sterile. Yeah, that has been going around in the rural areas and in the slums. And of course, the rural areas accessing Medicare is extremely difficult. So you see people rushing to the urban centers, bigger towns like Bombay, Delhi, Ahmedabad. And, that's another, difficulty that they are facing. The third thing we have been concentrating in the rehabilitation and the medium term is trying to support people with their livelihoods. So I think, direct benefit cash transfers, we are trying to concentrate on. We are also trying to give zero interest loans to people, which they can return back at their, whenever they find it suitable. And that is actually accompanied with business and financial counseling, trying to support them in doing business in new ways because of the lockdown. That's what we have been trying to do. And the fourth thing that we have actually been concentrating on is empowering them to access the social security schemes that the government is offering in terms of medical insurance or public distribution, in terms of getting food, cash transfers, etc. And the other big, phenomena that we saw this time, which was very particular to this pandemic, was that there was a big exodus of urban, people working in the urban areas, the poor, going back to the rural areas, since there were no livelihoods. And the government had no answer to that. I mean, we didn't think of that. There was no transportation facilities available. People were dying all around. And so we also did set up help desks to facilitate this migration from the urban to the rural areas. And it was in hundreds and thousands and millions of people leaving urban centers every day and going back to the rural areas. So this is what we have been largely doing there.
Thank you, Bijilben. Thank you so much. And again, when we've been speaking over the last few weeks, I think you've been mentioning again on even something like food distribution. And for those of us, the listeners who are not familiar with Swiggy or Zomato, they are food delivery services. And you were saying how the community is so afraid to step out of their house, given how quick this virus is spreading. And so how sort of, providing them these goods into their doorstep is really critical, even though their houses are so small, like you said, 18 square meters, even that is important. So they're not risking themselves or their families. And I think that's also something that many people perhaps don't realize is that social distancing is a privilege. Most of our slums and urban settings have very small houses, 5 to 7 people, and it's just a room, in fact. And so isolation cannot occur when 5 to 7 people live in one room. Most of our slum dwellings do not have running water or faucets, so hand washing cannot happen. And Bijilben, I know you and MHT have done a phenomenal job, not just in housing, but on the sanitation side. And unfortunately, we still have many community toilets across the country where hundreds of people share toilets every single day. And so again, when you're looking at these sort of CDC guidelines in the US, for example, they just cannot be maintained with a large percentage of our population in urban areas that live in these slums. And I think it's just important for everyone to realize that it's not just about a lockdown or the laws. Our country just doesn't enable these things to occur that the doctors are advising on. Purnima, I'd love to bring you in now for the next question. And with less than 3% of our population vaccinated, and I think that itself is so important for everyone, hopefully on this webinar to understand. Less than 3% of our population is vaccinated. And so the only way we've seen other countries beat this is through vaccinations, and we are nowhere close to those numbers. And so Purnima, it'd be really good to understand some of the work you all have been doing in terms of working with the community, both on the medical needs as well as dispelling the myths that Bijal spoke about as it comes to vaccines, as well as if you have any idea or if you can share with, I guess, our listeners on the supply of vaccines that even exist right now. Because I think that's also something that, again, many people have been speaking about in media of late. But please go ahead. And Purnima works with an organization called Swasti. Swasti is based in Bangalore. And if you can tell us a little bit about what the organization does, that'll be fantastic.
Great. Thanks, Deval, and thanks to the Dasra team for having us here. So I'll start with what Swasti has been doing for the past few decades. Our experience has really been working with vulnerable communities for over 20 years. And like Bijal then said, we recognized early that the challenges to well-being are not just limited to health. They're personal, social, economic, environmental factors that impact your health. So our models of care really addressed those pieces of work. And last year, when the pandemic hit, Swasti and the Catalyst group of organizations, which Swasti is a part of, anchored the efforts to bring together organizations like Swasti across various sectors that wanted to serve the most vulnerable and help them weather the impacts of this pandemic. And really what this has meant over the past year is 300 organizations have come together with various expertise in livelihoods, in public health, in private sector, in technology, to help each other respond. And this ecosystem has both organizations that are coming up with solutions and more than 150 grassroots organizations that have incredible reach and a trust capital within vulnerable communities that becomes really important to deliver services at this critical time. These include organizations that are working with migrant populations, farmers, sex workers, fisheries, informal sector workers, construction workers, and many, many more. So the ways we are responding, essentially, just to echo Bijal, Ben, and Piyush, material support required by these organizations to actually respond to the pandemic, to the second wave that is in front of us. The other prong is really bolstering the primary care support anchored really in community-based telecare. And this includes mental health, includes social protection, includes home-based care for families to monitor their own health. With this pandemic now reaching rural communities, it becomes even more important that that care is more decentralized and that people are able to monitor their own health and escalate at the right time so that not as much critical care is required. We need more decentralized care so that people don't move to needing an ICU bed, and while they're waiting, oxygen support or medical support is available to them. So we're setting up models for that and helping the organizations we work in. Again, supporting grassroots organizations, both health and non-health, to bring these approaches to their communities, acting as a technical and funding partner, fundraising partner for both commodities and support required on the ground. And finally, to answer your question, we're helping scale vaccination, again, using the trust capital gained by these organizations, by the civil society. So what we've seen is a two-layered issue within vulnerable communities. One is hesitancy, vaccine hesitancy, due to a very steep information asymmetry. So like Bijal said, there are lots of myths and misconceptions going around. And on top of that, people have genuine questions about vaccination, right? And they don't have access to people who can answer those questions. Like if I have diabetes or if I have HIV, will the medications interact with the vaccine, or what are vaccines? How do they help me? Are these safe? And these are not invalid questions. And a lot of us have access to healthcare providers that are able to answer some of these questions. We've run surveys within our communities and seen that, and this is vulnerable communities of some of which I just mentioned earlier. And we've seen a similar trend between both the general population and our communities, that about 50 to 60% people are willing to take a vaccine, and about 40% are hesitant. Within that hesitancy, majority of people actually said that they have questions about vaccines, and they'd like some answers before they make their decisions. And maybe about 10% to 12% have said that they absolutely don't want the vaccine because they don't perceive they're at risk, or they don't trust the vaccines or the system. So we're working using really the trust capital of the civil society organizations that and the grassroots organizations we work with, enabling these organizations to answer some of these questions that come up, bust some of these myths, really talk to people about getting vaccinated. But then the second layer is actually being able to access the vaccine in itself, right? And there's a couple of things that are going on there. You already mentioned vaccine availability is fast becoming an issue. Even before then, there was you required to register yourself on an online portal to get a vaccine. And as we know, there is a digital divide, a literacy divide that may stop people from getting access to that. And there's also an information divide. Where do I get the vaccine? How do I register? Is it available in my nearest PHC? Where do I walk in if I walk in to get a shot? And do I need a second dose at all? I think we did a vaccination camp with farmers outside in rural Karnataka, right outside of Bangalore, and we found that a lot of people were hesitant because their neighbors took the vaccine and got high fever, and they felt, and nobody had told them that this was normal and you to expect symptoms, right? So everyone was now scared that vaccines were giving them, making people sick or giving them COVID. So making sure that these key messages about vaccinations get out there is really critical. And we're working with communities to enable both myth busting and using the local governance structures to increase access. Our organizations are working with local PHCs to increase access, local gram panchayats, which is village level governance bodies that are able to fund transport to the nearest primary health clinic to get vaccines if the village is too far away for someone to walk into their primary health center. So there's a couple of ways to bridge the access divide and also bust myths and deal with hesitancy.
No, thank you, Purnima. And I guess clearly the fact that you have, Swasthi has been working again with so many vulnerable and marginalized communities for decades allows you to build some of this trust up, like you said, faster, and more importantly, really understand again, who are the high-risk individuals within your communities? How do you ensure that they are safe and provided urgent care? And even the COVID care centers that you are looking to set up is fantastic. Unfortunately, from everything we're seeing, whatever's happening in Delhi seems to now be happening or close to happening in Bangalore. So the wave, just for all of the listeners, sort of has gone from rural Maharashtra to Mumbai to Delhi, and now Delhi to Bangalore. And like all other sort of transmissions of this particular virus, it's very closely linked to transportation channels. And so Mumbai and Delhi have the highest flights. Then after that, it's Mumbai, Bangalore, Delhi, Mumbai again, and then Delhi, Bangalore. And so we're seeing this sort of play out in front of us. Thank you, Purnima. Piyush, I'm going to bring you back in again and really understand from you, what are you seeing on the ground in terms of what is the role of what frontline NGOs are really doing? What is the role of government? Are things getting better? How can they be improved? I know this is a very large, overarching question, but you know, you've been having sleepless nights for so many weeks now and working again directly with government. I think your perspective would be very, very helpful.
Sure. So what we saw, so firstly, I think one of the good things that the Delhi government did last year itself was to create empowered groups and task forces that already had a lot of nonprofits as part of the government's, the entire decision-making process. And that helped the mobilization aspect quite significantly in terms of getting people on the ground, looking at response both at an individual level, but also at a systemic level, and so on and so forth. So if you ask me what NGOs have been up to, I would say that I think except for the care part of things, right, which is where you have a large number of healthcare workers who are involved, who are exposed, who are doing 24/7 tireless efforts to save lives. I think nonprofits have played a role in providing assistance to people, to moderately sick patients who needed oxygen support, who needed concentrators, who were isolating at home, and gave them that support. There were many nonprofits who took care of home isolated patients by way of providing them supplies, food, and so on and so forth. There were many nonprofits that had set up sort of control rooms to respond to SOS calls on Twitter, other social media, and try and find beds, try and find oxygen for people, try and find oxygen refilling centers for people. And finally, I think, and hats off to these NGOs who did that, in even cremating the dead. In many cases, we saw that families were infected entirely. And when somebody would pass away in the families simply couldn't step out to perform the last rites. And that is where there were some nonprofits and some individual groups who really came forward to provide that support, to carry out the last rites with dignity and to ensure that the family gets that closure, which is very, very crucial. So it's been quite instrumental, and I think it's been, and which is why I said that, you know, while I'm representing Save Life here, I can say that that I'm doing so with a lot of humility, because there are so many other organizations who've done such incredible work that who I have personally donated from my personal savings, because especially the whole aspect of cremation, it's just something that really got to me, and something that was very, very critical and crucial at that point of time. As far as the government is concerned, I think Delhi has a very unique setup. It's a governance system that has multiple overlaps with the federal government and the city government and the state government and so on and so forth. So there were challenges as a result of that, and we are thankful that the Supreme Court, that the first Delhi High Court and then the Supreme Court stepped in to get Delhi its quota of oxygen eventually. So what's happened with all of these efforts and the court's intervention is that on May 4th, I was just looking at some statistic, there were close to 50 SOS calls that had gone out for oxygen from various hospitals. Yesterday, there was one call for SOS that went out. So there has been a remarkable change. The infections have come down, the reported infections, not the, reported fatalities have come down from about 450 a day to close to 300 a day. It's still very high. So there is still a lot more work to be done. We can't become complacent at this point of time, which is why it's important to continue building capacity, to continue to respond to what's going on. But I think the public-private partnership has really worked in this case, and within a matter of a few days, despite the various challenges, an entire response was mounted to this issue. which has evidently helped in what's going on.
No, thank you so much, Piyush. And I'll just ask again for people to continue to ask questions in the chat box. We are looking at them, and I'm using some of those now as well. So please put them there. Bijal, I know one of the things that we've been speaking about, in fact, last year, MHT and Dasra worked together to really look at financial resilience. And we at Dasra realized that with the financial impact that COVID was bringing, we needed to work with as many organizations as possible to think about financial resilience, look at their balance sheets, understand cash flows, because this was a time where corporate funding was affected significantly. Markets in the US and in other locations dropped again about a year ago. And so foreign funding was also taking a hit. And we will talk about Fcra amendments later, but there were various issues or laws in the past that were just negatively affecting the sector overall. And so I think last year we worked with 250 organizations as Dasra to really help groups like MHT think about financial resilience. And I remember even back then having conversations with each of these organizations, our team was saying, look, this is not a 1 month, 2 month, 3 month thing. This needs to be a 3-year thing. And we said that because one of our board members, Tarun Jyotvani, actually ran Lehman Brothers when it collapsed. And he said, anytime a crisis happens, the first thing that organizations and leaderships do is misread how long it's going to take to get out of this crisis. And so I think while we did that last year, I think conversations, again, Bijal, we've had right now, and with other organizations, knowing again that less than 3% of our country has been vaccinated, COVID is going to be present in our rural communities for the foreseeable future. And this is not 3 months, 6 months. This is probably 3 to 4 years, maybe even. And so Bijal, with your work, for example, that's been on housing and on sanitation and on rights, as well as livelihoods, how are NGOs going to operate when most of our work has been face-to-face? And what does this look like, I guess, not just for MHT, but for most NGOs that, again, whether it's education or health or livelihoods or rights or housing or sanitation, they're face-to-face meetings that occur. Where do you see, I guess, this going? And I think more importantly, hopefully from this, everyone who's listening, the need is not just 3 months, the need is 3 years. But if you can share a little bit of some of your thoughts and conversations you've had with NGOs, that would be great.
Yeah, the need is there for 3 years, as you said, Deval. And so I think we, 2 aspects we have addressed to a great extent. As you said, we are grassroots and we were used to doing everything so much face to face. And as COVID struck, mobilities were hugely restricted. And the first thing that we had to do is build our own capacities to operate more digitally, look at, platforms like Zoom or, Microsoft Teams, and look at more digital, interventions. Luckily, most grassroots organizations like us would have a presence at the grassroots since long. So in our example, we had these women community action groups, and so they were actually, we trained ourselves, and then we had an approach of training them and trying to bridge the digital divide. So a lot of the health awareness and the COVID awareness, in fact, we reached almost 300,000 women, and through, if we count their families, it will be almost 1,500,000 individuals. And that was through Zoom or WhatsApp, and through the smartphone. Although one thing which we observed was that after the first phase, when the lockdown was being released gradually, there were about 37 to 40% families, 37% to 40% families in one slum which had access to mobile phones, and largely with males. So the women still did not have them. And as the lockdown was getting released and men were going out to work, that access to smartphones became limited. So that's what we had concentrated on. And we were really thankful because I think that was a very low cost model, and we had our community groups already empowered through long years of engagement. So I think that's what most NGOs and not-for-profits have been focusing on. Longer engagement, empowerment, trying to bridge the digital divide. That's one thing. I think so far, as the financial resilience of the organizations like us is concerned, yeah, it's a long way to go still. But I think we are trying different ways. So, broadening your landscape of, reaching the funders. Organizations like Dasra are extremely important. One, in helping us think through that. Secondly, also in supporting us to increase our outreach to donors and funders who are more flexible, because speed has been of essence here. Again, we have started using technologies to raise individual donation appeals, especially for the pandemic, and which we, like organizations like us, like MHT, never did it before to, appeal individually to donors, but we started that. So I think we have expanded our donor base from only family foundations to corporates. Secondly, I think our own resilience models on the ground have tightened due to more digital interventions. I think thirdly, organizations like Dasra are much needed to, sort of bring these issues to donors and sensitize individual donors and family foundations and others abroad as well as in India, and they have played a huge role. And we still have a long way to go in terms of financial resilience, but we are now developing the paths together.
No, thank you so much, Bijoben. Purnima, there have been a few questions that I've been sending you on the chat box. I think one is around mental health and what are some of the areas that you've seen either Swasthi or the partners working towards. And the second is really from Dhruv Ketan around if vaccines is the only solution, is there a plan, and how can the private sector get more engaged? So if you can answer any one of these, that would be great.
Great. Thanks, Cyril. So I think Angela is also a partner at Swasthi, and she's been answering some of the questions that are coming up on the chat box. So thanks, Angela. On the mental health piece, I'll just quickly say that, like Bijoben said, we've also been pivoting towards more digital solutions for our communities. And it really makes a difference when there is a presence on the ground. So using that trust already built up in the community helps increase service provision. There is hesitancy to use mental health services, and especially over telecare. So we've been using both the community-based outreach model and then increasing availability of these mental health services through our telecare platform that addresses both physical primary healthcare, mental health, and the social protection piece. And that's one of our approaches. Sorry, the second question was around what they were?
On vaccines, and can private sector play a role, and is there a plan even?
That's a really good one. And I think everybody in the country is asking that question currently, specifically around availability. And if production doesn't scale up, what happens? I think we're all trying to figure out what the master plan is going to look like. Likely what's going to happen is states are going to make their own decisions around who is the most vulnerable, and based on that, provide access to those communities at this point. As long as the supply chain issues get figured out. So we've already seen some states make decisions around not providing vaccines to everyone over 18 and only providing them to over 45. I think there are states like Chhattisgarh that have decided that migrant workers and people and folks that don't have the luxury to isolate at home, daily wage laborers and people who are from economically weaker sections of the society will be prioritized. So states are making their own decisions based on what's available and who's the most vulnerable. And we're hoping that the private sector does step in to play a bigger role. So at least for people who can pay for vaccines, I think with the open market, that will be helpful. We just need a little bit more regulation of what's available and what the supply is going to look like. We don't have visibility on that at this point.
Thank you so much. Piyush, would you like to add anything on that? There's also a question around, are oxygen concentrators still the need? And I know, again, we've been speaking about the accessories that are also required. So maybe if you can talk a little bit about that and other needs, Piyush, that you're seeing beyond the concentrators, since that clearly has gained the media's sort of eye in the last few weeks.
Sure. So just in terms of the whole vaccination piece, I'm not sure if the law currently in India allows for non-profit or the private sector to be directly involved in vaccine procurement or distribution. I think the aspect of creating awareness that Purnima and Bijalben spoke about is very, very critical to encourage more people to come forward and take the vaccine. I do think, and that's a conversation that we've been having with one of our larger funders, is the entire need for investment in genome sequencing. There's this whole aspect, whole conversation happening about the Indian strain and the multiple strains that are coming up. But there's very limited understanding that is available at this point of time within the country in terms of what these strains are, how they are mutating, what's coming next. So I do feel that there is a very, very crucial need to invest in universities or other institutions that are carrying out this genome sequencing piece. And I do think that funders can play a key role there in addition to government funding. As far as the question on the need for concentrators, well, let's understand a few things. Concentrators support moderately sick patients. And they support moderately sick patients for a limited amount of time to make sure that they don't rush straight to the ICU or straight to the emergency room when they feel sick. But concentrators, and in Delhi, for example, a large number of concentrators have been received. Many are on their way, including the ones that we've ordered. So I do feel that Delhi as a city perhaps doesn't need as many concentrators as, let's say, a Bangalore needs right now, or what Chennai would need, or what rural UP has been asking for some time now. So yes, there is a need, but that need is in many other parts of the country, and that's where that aid should be directed towards. In fact, we've been in touch with an organization in UP that is doing work in about 25 districts in UP, and looking for concentrators, looking for cylinders. And we've put them in touch with some of our funders. We've also put them in touch with some of our suppliers to see if we can expedite the delivery of some of this material to them. But what is needed at this point of time in Delhi, especially because it's treating, like I mentioned earlier, patients from 8 other states, and especially from rural communities where people are just rushed to Delhi being the nearest level 1 center, is the aspect of adding more ICU beds. Now the oxygen SOS calls have stopped, but if you see India Twitter or Delhi Twitter at this point of time, you will still see SOS calls for ventilator beds, for ICU beds. So that's still a big need, and we've started procuring ventilators and ICU monitors to be able to enable additional beds. And what we are currently campaigning for is to be able to add 100 beds at least to the current supply of ICU beds in Delhi, so that we can have at least 100 patients every week or 2 weeks can be treated in that in those facilities. In addition to that, there is a big need that is emerging for, and that Bijalben has covered quite significantly in terms of livelihoods. That there are a large number of people, the urban poor, who are out of jobs, who are not getting their salaries, who are earning day-to-day basis, and there is a big need in terms of supporting those communities and coming forward to help them. And that's something that many organizations are doing, and they are the ones who should be strengthened also in aid of people like these.
Thank you so much. Bichobin, we have a question from Mehed regarding migrants, and in spite of having jobs, why are they going back to rural areas?
I think the first wave has shown us that I mean, people did have jobs, but most of them are daily wagers, and we have you know, you don't really know, so we are not really sure. They are not really sure when the jobs will absolutely close down. So today you are there, and suddenly tomorrow your business association or your textile mill owners association or the government declares a lockdown and you are stranded. You are not earning, but you have to still pay your rents, which are very high. And no one is, you know, relieving you of the rent paying. Secondly, you're also there almost without your immediate families most of the time. And so you really want to be with them in such times, be together. And that's, you know, the social support that the poor families are seeking, because when you really don't have access to money or to any other resources, I think it is the community network that really mentally and socially boosts you up. Those are the two things. And I think the third thing is also that it's very obvious that the urban areas are the worst hit in terms of the spreading of COVID because of the density, especially when the poor live in the slums. Although the second wave has spread to the rural, unlike the first wave, in the rural, it was non-existent during the first wave. In the second, it is there now, which is a pity, but still the numbers in terms as compared to the urban areas are much, much lower. So it's a mix of all this.
Thank you so much, Bijoban. Thank you so much. And there are a few questions that I think I will field. Number one, I think, was how can we have greater transparency of funds being received and dispersed? And so from a Dasra lens, what we decided was we will try to fund as many organizations as we can in this time of need, given different geographies have different pain points and different interventions are required for this. And so what we have done and we decided was to cap each disbursement to a maximum of $100,000 or no more than 25% of an organization's budget. The reason we've taken this call is because we don't want to see NGOs implode. Many of us, 30 to 50% of our staff are infected or have family members who've infected. This past week alone, one of our board members had both their parents pass away in a week. We've had multiple deaths, and giving funds to organizations or excess of funds, honestly, because they're so committed to the communities they serve, will actually can be negative if you overcapitalize them. We've seen this in the tsunami, we've seen this in other disasters, and so that's why we've kept this cap. All of the organizations that we're funding have been registered on GuideStar or will be going through that GuideStar India process. And so financial, legal, compliance is all taken care of. This is something that we've seen for the last 15 years. We always ensure that GuideStar organizations are the ones who get supported. And in the money that we're giving to these NGOs, we're giving them full flexibility to use those funds to also get registered on GuideStar, because we think it's an important way to ensure that they're transparent and reduce their transaction costs when donors support them. In terms of decisions, we have an investment committee set up with individuals from across Dasra that are reviewing these applications. We're doing reference checks with other funders. And many of them we've spent a minimum of 4 weeks with through our leadership programs, the Dasra Social Impact Program, or groups like Bijilben. We've actually spent up to 50 days a year, if not more, with them over a 5 to 7 year period. So trust is critical when we're making these decisions. Another question talks about how to access funds to local NGOs without FCRA. We are pushing Indian donors to only fund NGOs that don't have FCRA. We've been very fortunate. Out of the $6 million raised, a majority of that has come from foreign funders, and there is a greater appetite for foreign funders to give right now, but they can only give to FCRA registered organizations. And so we are starting a new campaign next week for Indian funders just to fund NGOs that don't have FCRA, to supplement the foreign aid that's coming in, but also focus on those who otherwise cannot access these resources. And then finally, the FCRA amendments have made it extremely difficult, as have PM CARES, other government regulations. All of us as NGOs have to re-register right now. For the last 3 months, all of us have to re-register for FCRA. All of us have had every month a new regulation put in since COVID has hit, making it extremely difficult to serve the communities that we're here to serve. We will be sending payment links for people to donate, whether you're in the US, UK, or India. These are tax-deductible donations. 100% of the proceeds, thanks to our board and a few key funders, is going to these organizations. And our goal is to support 100 organizations or raise $10 million worth of funding in the next few weeks, enabling groups to meet the needs of their community. Thank you all for participating in the webinar today. Thank you all for donating. And most importantly, Piyush, Bijal, and Purnima, thank you and your teams for literally risking your lives in making a difference in the communities you serve. You are our role models. Good night.
Thank you so much.